Hello again to everyone. My name is Alex Mitchell, and I'm a communications manager with the Lighthouse Lab Services marketing team. And I'm here today with Claude Rector, who serves as an assistant professor in the Department of Clinical Laboratory Sciences at Arkansas State University and was recently chosen as President-Elect of the American Society of Clinical Laboratory Science. Claude, thank you for joining me today.
Thank you for inviting me.
I think we're just going to chat a little bit about some of the happenings with ASCLS. And first off, congratulations on being selected as president-elect this past July. I understand your organization recently held its legislative symposium in Washington, D.C. last week, and I was hoping you could talk to me a bit about how that went and what came out of it.
Okay, sure. Some had virtual meetings, some had face-to-face, some will meet, inside the office with the senator for a 30-minute sit-down to discuss the issues. Some will be on a virtual call with staff members. So usually it's a key member of the staff that oversees their health issues and their health bills, and they're usually well-versed in our issues, but it was a chance for us to give them an update. So I can give you our main topic, the one we really were excited about, was we've been battling Pama, and we've been taking that to the hill, and we've been real successful in getting delays in those cuts with the acts. You know, the senators or the congressmen will make recommendations and get those cuts delayed. So it's been a process of about a few years of delays. But they were scheduled to go into effect still in January. Well, we're excited to announce that there has been an introducing of the SALSA Act, and this is Saving Access to Laboratory Services Act, and it's a House bill and a Senate bill, so it's a bipartisan. We got support on both sides of the aisle, and this is to basically take the problems with the assessment of the fees into account and to get a better picture of the fee schedules before the cuts go into place. If you've met with the senators in the past years, it was real easy for them to understand our push. They knew Pama, they knew the problems with Pama, and then they were excited to hear that there was legislation that they could support that would help us fix the problems with Pama. So that was our main push this year because the 117th Congress is in their last couple of months. So we're wanting to get this done by the end of the year. We're hoping it will be packaged so that we'll get done by the end of the year. The writer is Senator Burr from North Carolina, and he's retiring. So we felt like that was would be a great way, or a great point to take to our senators and say, you know, it would be great to get this through this year, so it doesn't have to get introduced next year. So that was the real push for us. We can't afford cuts. You know, I take it to the senators like, you know, if we're struggling as it is in the lab for staffing, we're struggling in the hospitals for replacing people when they retire, hiring new people. There can be hiring freezes in the labs, and we know, us that have worked in the hospitals know this administration sees declining lab reimbursements that could adversely affect our staffing. It definitely could adverse the ability for our departments to say, look, you know, we need an extra spot, we need another employee, we're short as it is. And when reimbursement get cut, it just turns the other way, where they notice. I've had administrators tell me in the past, you know, y'all need bigger tests, y'all need more expensive tests. If I could get more out of each one of your tests, and basically the example was, do you know how many CBCs you need to run to equal one CT scan? So that's the way they look at it, and we want to, you know, put that spotlight back on the lab, and we want them to know that we don't want any cuts, and we hope that we can at least get, if they're going to do anything for cutting Medicare, that we don't have to see lab get slashed like it was scheduled to get slashed.
No, absolutely, and it's great to hear that you guys were pushing on that issue. It's been a huge thorn in the side for us for years and years, like you said, going back to the introduction in 2014. And we've been watching SALSA very closely and hoping that it gets that passage before those cuts go into effect in January. So we're really glad that you guys are continuing to advance that message on the Hill.
Yes, it was well received. I think that if you've never gotten to go advocate on behalf of the lab profession, when you can take something in there, when there's something on the floor, when something's been introduced, it seems like they're more receptive to knowing that they can make a difference really quick. But anything that we already have introduced or we've supported and we're looking for more support, it just seems like it's better received from that office.